New South Wales has reached another major milestone in the pandemic. 70% of adults have now had at least one dose of the vaccine. That's more than 7 million jabs. And as a reward, the 1-hour limit on exercise in Sydney's hotspots will be scrapped. But the case numbers remain high, and another 7 people with COVID have died. The Premier says Australia needs to accept that a future with COVID is the only reality, and that society must begin to reopen when vaccination targets are met. Here's state political reporter Ashley Raper.
Life in Sydney's west and southwest has been challenging, and it's taken a toll.
Exercise with just a 1 hour has been a mental challenge, I think. Really kind of felt like that was one of the things we were using to keep sane, so just really felt like the walls are closing in.
From tomorrow, that 1 hour restriction on outdoor exercise will be abolished, a week and a half after it was introduced.
Just not that added pressure of feeling like you're doing something wrong when you're exercising for 1 hour and 2 minutes or something. So, no, it'll be good.
I think it's fantastic.
It was a combination of health advice but also well-being. We want people to get fresh air.
The other restrictions will remain, and all declared hotspots will stay in the zone for now, despite the Premier previously indicating some may be removed.
We only have single-digit positive case in a week. We really think that if Burwood can get out from that, the 12th hotspot, then that would be really, really good, really helpful.
Overall, cases remain high, and there were 7 more deaths.
Death is horrible, but we also need to put things into perspective, because at the moment there are 8 million citizens who don't have a choice in how they spend their free time, who don't have a choice about what they can do when they can leave their homes. That is no way to live.
Life won't change yet, but the Premier insists the state's psyche can start a transition.
The sad reality is, outside of a pandemic, we lose between 600 and 800 people every year to the flu, accepting that unfortunately people will die, but they will less likely die if everyone is vaccinated.
New South Wales today reached the milestone of having 70% of the adult population with one dose of the vaccine, the first state to do so. Reaching 70% double dose and then 80% underpins the Premier's plan for living with COVID, and she's positioning herself to lead the way for the nation.
All of us as Australians have to accept that living with COVID is the future. It's not an option. It's not an option that any of us like, but it's an option we have to confront.
Options are limited from every perspective. Ashley Raper, ABC News, Sydney.
And Ashley Raper joins me now. Ashley, the Premier's used some of her strongest language yet about the reality of living with COVID.
Over the past few weeks, Juanita, we've seen a gradual change from the Premier, where she stopped dwelling on the case numbers and abandoned the notion that they can get to zero or close to it. But yes, today was the strongest language she's used yet about living with COVID, which is perhaps a reflection that she's confident the state is hitting its vaccine targets quickly. And there's also been a slight shift in the approach to COVID zero in Victoria. So Gladys Berejiklian may feel she's not so much out on a limb. This also allows her to reposition herself to be back on the front foot, which the Premier has struggled to do for weeks. And Juanita, Gladys Berejiklian has acknowledged that not everybody is comfortable with this plan, so she does have a task ahead of her.
Ashley Raper reporting there. The Premier says as vaccine coverage keeps climbing, the most important number will be how many people need to go to hospital. Already, the hospitalisation rate is falling, but some experts warn the health system can't take much more stress.
A nurse holds the hand this patient's family can't. The closest they can get is a video call. The government's given this glimpse of the isolation in ICU. Staff in the weary southwest say the pandemic is physically and emotionally exhausting.
We've seen the pressure on the Western Sydney hospitals resulting in them having to stop taking new admissions and to pivot pretty much largely to COVID care.
And paramedics are constantly left waiting with patients outside. In just the last month, the number of COVID cases in hospital has quadrupled. There are almost 1,000. Compare that to the start of August, when there were about 230. Total infections are growing much faster. About 20,000 people have the virus right now. That means the hospitalisation rate is currently falling. It's under 5%. More patients will need to come to hospital every day while this outbreak grows. The Premier says high vaccine coverage will keep hospitalisations at a manageable level, but some fear the health system won't cope.
Once we open up, the numbers are not going to be 1,000 a day or 1,300 a day. They're going to be in the tens of thousands a day.
How is the health system going to cope then if it's on its knees now?
It's not. The health system in New South Wales is world class.
The government's had 18 months to prepare for this moment. It'll soon be put to the test. Tim Swanston, ABC News, Sydney.
There's mixed news for regional parts of the state. Western New South Wales has continued its recent trend of slower growth with 23 new cases. But there's been a sharp increase in the Illawarra Shoalhaven, another 22 infections there. There were 7 new cases on the Central Coast, 5 in the Far West and 4 in Hunter, New England. Wilcannia in the Far West has been one of the state's worst hit areas. Some of those who've experienced COVID-19 have revealed how it's affected their lives.
Emerging from isolation, Wilcannia elder Auntie Anne Curry tends to her garden. The past fortnight has been anything but pleasant.
It was hard, I tell you. It knocked me around for the whole 2 weeks.
The local leader was struck down by COVID. She says she now feels weak and has trouble breathing.
I couldn't eat nothing and just coughing constantly, bringing up phlegm. It was terrible.
She's one of many who've had the virus. Michael Kennedy, his partner and 2 daughters were also infected. He's thankful his family is all right, but worried about the rest of the community.
It does feel good, but at the same time, you're still so worried and frightened for the rest of our family and friends in the community.
The arrival of the pandemic in this small, isolated town caused problems with supplies, but people on the ground say the situation is improving.
Police and ADF have really helped our volunteer efforts because that's helped us be able to distribute large volumes, which we didn't have the capacity for before.
The Rural Fire Service has set up a temporary camp for out-of-town volunteers, defence personnel and police officers. It'll mean they'll be able to stay here as long as they're needed. More than 12% of Wilcannia's population has tested positive for COVID-19. That infection rate would amount to around 600,000 people if applied to Greater Sydney. And many locals here are still asking how the virus got here in the first place.
They didn't really listen to us, and no planning got done around COVID, and you can see that today. That's why, there was people setting up tents in their yard.
No one ever took this serious until now.
All residents can do now is stick it out and stay safe. Bill Ormond, ABC News, Wilcannia.